So, let's talk about something almost all of us do, but a lot of us dread: going to the doctor. Not because we don't value healthcare, but because the whole experience can feel rushed, confusing, and honestly a little intimidating. You show up with a concern, and somehow you leave with 3 new questions you didn't even know you had.
And sometimes you leave with that classic feeling of, wait, did I explain that right? Or you remember the most important detail. In the parking lot, it's like your brain saves the good information for after the appointment.
Exactly. Today we're doing a practical episode. Think of it as a guide to making doctor visits smoother, whether it's a routine checkup, a new symptom, a chronic condition follow-up, or even a specialist appointment. We'll cover what to do before you go, what to say in the room, how to handle tests and prescriptions, and what to do after you leave.
And we're going to keep it real. Not everyone has the same access. Not every clinic runs on time. And not every provider communicates the same way. But there are tools you can use in almost any situation to get clearer answers and better care.
Let's start with the part people skip: preparation. Before you go, try to write down why you're going. Not a full essay. Just a short list. What's your main concern? When did it start? What makes it better or worse? What have you tried already?
Because if you walk in and say, I don't know, I just feel off, that can be true, but it's hard to build a plan from that alone. Even a few details can help. Like, is this fatigue new or long-term? Is it constant or in waves? Are you sleeping more or you can't sleep at all?
And here's a big one. Bring a medication list. Not just prescriptions. Include vitamins, supplements, anything you take regularly, and anything you take occasionally. If you don't know the names, take photos of the bottles.
Also, if you've had reactions to medications in the past, write that down too. People sometimes say, I'm allergic, but what happened matters. Was it a rash? Trouble breathing? Stomach upset? Those details change decisions.
Yes. And if you're seeing a new doctor or specialist, it helps to bring key history, major diagnoses, surgeries, hospitalizations, and any important test results you have access to. You don't need every detail from childhood, but you want the big puzzle pieces.
Now let's talk nerves. It's normal to be anxious, and anxiety can make it harder to remember what you meant to say. One simple trick is to bring a Notes app checklist or a small piece of paper. Not because you're being dramatic, because you're being efficient.
And if you can, consider bringing a support person. Someone who can take notes, remind you of your questions, or just be there. Especially for complicated appointments, new diagnoses, or anything emotionally heavy.
Okay, you've arrived. The waiting room is doing what waiting rooms do. You finally get called back. Here's the moment where a lot of people minimize their symptoms. They'll say, it's probably nothing, or I don't want to waste your time.
I want to pause on that. You deserve care even if it turns out to be nothing serious. The goal isn't to prove you're sick enough. The goal is to get information and, if needed, treatment.
And it's totally fair to be direct. Something like, I'm worried because this is new for me, or this is affecting my daily life. Doctors are trained to prioritize. If it's impacting sleep, ability to work, ability to eat, or safety, say that clearly.
A practical way to structure what you say is what it is, how long it's been happening, and what you need. For example, I've had headaches for 3 weeks, they're getting more frequent, and I want to understand what's causing them and how to treat them.
That last part is key. What do you want out of the visit? Reassurance? A diagnosis? A plan? A referral? A medication change? If you say it out loud, the appointment has a destination.
Now, let's talk about questions that can turn a fast appointment into a useful one. Here are a few favorites. First, what do you think is the most likely cause? Second, what else could it be?
And then, what are we doing today to narrow it down? Because sometimes the answer is, let's watch and wait, which would be totally appropriate, but you want to know what you're watching for.
Yes, ask, what symptoms would mean I should call you sooner, or go to urgent care or the emergency room? That question is powerful because it gives you boundaries and reduces panic later.
Another one, if this treatment doesn't work, what's the next step? Not because you doubt them, but because you're making a plan. It's like having a map instead of guessing at every turn.
Let's address something sensitive. When you feel dismissed. It happens. Maybe the provider is rushed, maybe they misunderstand, maybe there's bias in the system. If you feel like you're not being heard, you can try a reset phrase like, "I want to make sure I explained this clearly. This is really affecting me."
Or even, "Can you tell me what you're considering and why?" That invites them to share their reasoning. Sometimes the logic is solid but not communicated. Other times, that question highlights that the concern hasn't been fully addressed.
And if you're uncomfortable with a plan, you can ask, "Are there other options?" Or "What are the risks and benefits?" You're allowed to participate in decisions about your body.
Now let's talk tests. People often here will order labs, and they think that's the end of it. But you should ask, what are these tests looking for? When will results be ready? How will I get them? Call, portal message, follow-up visit.
Also ask what a normal result means. Because sometimes a normal test doesn't automatically explain your symptoms. It might rule out a scary thing, which is valuable, but you may still need a next step.
Same with imaging. If they say you need an X-ray or an MRI, ask what they're trying to confirm or rule out and how it might change treatment.
Okay, prescriptions. If you get a new medication, ask 3 basic questions. How do I take it? What side effects should I watch for? And how soon should I expect improvement?
And one more. Does this interact with anything I already take? Even supplements, even occasional meds. That little question can prevent a lot of problems.
Let's not forget the most overlooked part of the visit, the end. The provider stands up, the visit feels like it's over, and people freeze. This is your moment to summarize.
You can say, "Just to make sure I got it. You think it's likely X, we're doing test Y, and I should do Z at home. Is that right?" That one recap can save you from confusion later.
And ask what follow-up looks like. Do you need a recheck in 2 weeks? 3 months? Only if you don't improve. The plan should include time, not just steps.
Now you leave, and this is where your real work starts. Do you understand the instructions? If not, check the visit summary if you have one, or use the patient portal to message a question. It's normal to need clarification.
Also, keep your own health notes. If you started a treatment, track what happens. If symptoms change, write down when and how. If you're trying to figure out patterns, simple tracking can help. Foods, sleep, stress, cycle timing, workouts, whatever seems relevant to your situation.
Let's do a quick role-play scenario, because examples make this tangible. Say someone goes in for stomach pain.
Okay, so the patient might say, "For the past 10 days I've had pain in the upper middle part of my stomach, usually after meals. It feels like burning and pressure. Antacids help a little. I haven't had vomiting, but I've had nausea and I'm eating less. I'm here because it's not going away and it's affecting my work."
That is gold. It gives timeline, triggers what it feels like, what helps, and impact. Then the questions, what do you think it is? What are you ruling out? If we try medication, how long before it should help? And what signs will mean I need urgent care?
Perfect. Another common one, a routine checkup where you feel fine, but you want to be proactive. People sometimes think there's nothing to discuss, but you can still make it meaningful.
Right. You can ask about screenings for your age and risk factors. You can bring up family history changes. You can ask, is my blood pressure where it should be? Or, are there vaccines or boosters I'm due for? Or, what's one thing you'd recommend I focus on this year for my health?
And if you've been putting off something, sleep, mental health, stress, alcohol, diet, checkups are a great time to bring it up without it having to be a crisis.
Let's touch on telehealth, because that's part of modern doctor visits now. Telehealth can be great for follow-ups, medication refills, simple infections, skin issues if you can show them, and discussing lab results.
But for telehealth, preparation matters even more. Make sure you're in a place where you can talk privately, have good connection, and have your info in front of you. And describe symptoms clearly since they can't always examine you.
If you're worried something needs an in-person exam, it's okay to say, "Do you think I need to be seen in person today?"
Before we wrap, I want to acknowledge the emotional side. Sometimes going to the doctor is about fear of bad news, fear of being judged, fear of cost, fear of not being believed.
And if that's you, you're not alone. A helpful mindset is, you're gathering information. Even when information is hard, it can move you toward action, relief, or a plan.
So here's a quick recap listeners can remember. Before the visit, write your top concerns and bring your meds list. During the visit, be clear about timeline and impact, ask what they think it is and what the plan is, and ask what would require urgent attention. After the visit, review instructions, track changes, and follow up if you're confused or not improving.
And if you take nothing else from today, you are allowed to ask questions. You're allowed to take notes. You're allowed to understand what's happening. That's not being difficult. That's being an active participant in your health.
That's the episode. Next time you have an appointment, try using just one or two of these tools and see how much it changes the experience. And if you have a friend who always forgets what to say in the room, maybe share this with them before their next visit.
Take care of yourselves, and we'll talk again soon.